Hey guys, so today I wanted to talk about a topic that once I grasped this topic, I really feel like I started doing a lot better in medical school, especially on my clinical rotations. So Plato, this really old guy, he had this idea that all the goods and physical forms that you see in the real life, they are a manifestation of the metaphysical form that exists in a make-believe world. So if you kind of think of, let's say, a toy horse, you have this fictional horse, and then each time you see a real horse, it looks a little different, but your brain knows what you're seeing because your brain has a mental model of what a horse looks like. So my big idea is basically you can start applying this to diseases and get a lot better at diagnosing them. So an example I wanted to go through, let's say your friend just got back from a trip to the Grand Canyon, and they show you a picture from their trip. So, you've never seen the Grand Canyon before. Now you go, okay, now I know that a Grand Canyon is this flowing river with some red rocks around it. You're like, okay, fine, that makes sense to me. But then another friend goes to the Grand Canyon, and this time they're like, hey, check out a picture. And this time you're like, okay, the Grand Canyon is, a bunch of barren rocks. There's no river. So now your brain is really confused because you have two competing schemas for what the Grand Canyon looks like. And so the way Plato would say that you reconcile this is by realizing that there's a bigger picture to everything. So you have seen two pictures of the Grand Canyon that look totally different, but the reason is they're just small screenshots from a much larger picture. So disease I want to give an example for. Let's say you have someone with the flu. So let's say you see someone with fever, body aches, a stuffy nose. You're like, okay, that is a pretty clear-cut case of the flu. I can easily recognize that as the flu. Now let's say you see another person and this person also has vomiting and diarrhea. You might be a little confused now because in your mind you've only memorized the most common examples of the flu. So it's it's a little confusing as far as why someone would also have vomiting. Now I'll give you a third person with the flu. This person has cough and shortness of breath. Or how about a person with vomiting, diarrhea, sore throat, but they don't have fevers, they don't have a headache, they don't have a cough. So really what I'm trying to say here is with each disease, you want to start thinking about a big picture that encompasses all possible symptoms. Now, obviously, the more of a broad disease you have, like the common cold, like the flu, you can have a lot of different manifestations. So that, that's why we want to get out there and see more patients so we can build better illness scripts. A couple examples I want to draw your attention to. So everyone in medical school learns the classic triad of reactive arthritis. You have can't see, can't pee, can't climb a tree. Or let's say with Wernicke encephalopathy, you have ataxia, confusion, and nystagmus. If you were relying on that to diagnose Wernicke encephalopathy, you would miss 90% of cases. Same for Wilson disease. Let's say you're relying on those Kaiser-Fleischer rings. If that's what you were relying on to make the diagnosis, you would miss almost all your cases. Same for hypocalcemia and the Vostek sign. Or aortic stenosis. If you were relying on syncope, angina, and dyspnea, you would miss all your cases. I think what really sealed the deal for me, almost everyone in medical school learns the Beck's triad, the hypotension, JVD, and muffled heart sounds. The sensitivity for this finding is almost zero. Same for the Reynolds pentad. So really the big idea is, start fleshing out your understanding of a disease. Whenever you see someone with a certain disease, go and look it up and think about what other symptoms they could have had. And then you kind of quiz yourself, if let's say someone had a couple other symptoms, would you still have made the diagnosis? I'll give you an example. What if someone with dermatitis herpetiformis, instead of this rash on their elbows and knees, what if it was on the back of their neck? Would you still have made the diagnosis? And Obviously, these things aren't easy, but they're worth working towards. So hopefully this concept of Plato and his forms can help you with your patients. Thank you, guys.